JPL's time today. We're going to be talking about reducing patient falls. Just a little bit of information about it is we're going to be developing a plan to reduce falls on the inpatient unit, discuss the why. We need to start this today and present you data for the need for fall reduction and discuss 2 interventions and expected outcomes. According to the Agency for Healthcare and Research and Quality, a fall is defined as any unplanned event, descent to the floor that may or may not result in a harm to a patient. And there's an average between 700,000 to 1 million falls per year in hospitals. Inpatient falls account for 40% of adverse events within hospitals. 42% of these falls result in injuries to the patients, and another 8% result in serious harm or even death. As nurses, we're all aware that since 2008, CMS does not reimburse hospitals for a hospital-acquired event, and this would be considered a fall as well. So if there's any cost associated with a fall, needing surgery, the hospitals we are the ones that pay for that. We don't get reimbursed. Research has also shown that at least 1/3 of all falls can be prevented. So we as nurses must do our best and our due diligence to help decrease the number of falls that happen in our hospital. The objective of this project is to increase nursing knowledge of the hospital's current fall rate versus the previous years, discuss potential cause of the rates from previous year, discuss 2 interventions and that would help to decrease the falls, and discuss how we monitor the results. And I want all of the nurses to understand it's vital that we start today in reducing harm to our patients by preventing falls. Falls are considered a nursing quality measure. Nursing is the key driver in reducing patient falls, which results in the quality care for our patients. As we all know, the hospital came close to closing in 2015, and as a result, our quality and safety suffered a bit, and we need to refocus on that and get our falls down and drive our patient safety and quality up. The facility's fall rate in 2015 was 3 falls per 1,000 patient days, and according to the October 2016 data, we are at 5.1 falls per 1,000 patient days. There was 22 falls alone in the month of September. So as you can see, there's an urgent need to us to refocus our safety and quality and have a fall prevention plan. I think we just had a lack of focus on the falls on the inpatient units, and change needs to include forming a formalized fall prevention team and hardwiring hourly rounding on our patients. This is the PICO question. How do methods such as development of fall safety team and hourly rounding decrease falls compared to current state and fall prevention? And I will show you the data that supports this. Falls can be reduced by having a focused fall prevention team and focused hourly rounding done on patients, and we'll discuss both of these more in detail. Evidence-based practice shows that forming a multidisciplinary team can assist in decreasing the amount of falls in hospitals. And the team should consist of nurses from the bedside, pharmacy, risk management, CNAs, and anybody else deemed necessary for the patient fall team. There's been some literature reviews that show that with having an active falls team can lead to a decreased number of falls from 1.9 to 6.9 falls per patient days in one study. Another facility implemented a falls prevention team, and data showed that after 1 year, the hospital decreased the fall rate from 8.9 falls to 7.8 falls per 1,000 patient days. Evidence shows for the hourly rounding with a purpose has shown to assist with decreasing the number of patient falls on the inpatient units. One literature review showed the following statistics related to decreasing falls. A 6-year study showed hourly rounding focuses on the 4 Ps, dropped the fall rate from 5.46 to 2.19 falls per 1,000 patient days. Another one reviewed showed that a 29-bed acute care facility that had a structured hourly rounding plan decreased falls by 39% during the study period. And yet another study showed a 25% decrease in falls related to hourly rounding. So purposeful hourly rounding is beneficial in reducing patient falls. So my recommendations are to develop a multidisciplinary team to focus on patient fall prevention, discuss the value and purpose of the team along with the current fall data with the administrative team and nurse leaders to ensure support of the project, because I'll need their assistance. Managers will need to assist in identifying core team members that would appreciate the value and purpose of the team. And once again, have multiple team members, include from all units, a bedside nurse, some CNAs, pharmacy, a risk manager, and any other team members they deem necessary put by the team. The team will meet monthly to review all falls, look at commonalities in falls. So are they all getting up to go to the restroom, or is it all at night, or is it during the day? And they're going to evaluate, recommend processes in preventing falls team to assure that all fall data is shared with staff. They're also going to educate and reduce fall prevention, give the data, and also work on hardwiring our rounding process. The team would assist in educating the bedside staff on the purpose of hourly rounding and the current data that shows the majority of falls that happen in the facility are bathroom-related falls at this time. Work with the management team to develop the hourly rounding, incorporating the 4 Ps. So you would round hourly, the nurse rounds on the even, the tech rounds on the odd, and you're addressing pain, so the patient's pain level, if they need to go to the potty, positioning and possession, so making sure that their water is near them, all their possessions are close by with an arm's ring. Hourly rounding education is to include to nurses on the even hour, as I discussed, in the odd hour for CNAs, and education will also include our current data that shows a decrease in falls related to the hourly rounding. The fall team and management would need to assist with the scripting of the hourly rounding process and do spot checks on the units to make sure that this is processed. This is hardwire process. Developing the falls team and incorporating the hourly rounding will assist with improving the quality care and reduce potential harm to our patients. How this would be evaluated is the evaluation of the success of the project would be the continued data collection of the patient's falls by unit, and the data is to be assessed and evaluated by the falls team monthly. If the project is successful, we will see a decrease in the number of patient falls, and the team will meet monthly, and there will be monthly fall data that can be compared to prior year's data. The expected outcome is that there will be an overall decrease in unit level and overall hospital's overall fall rate, and decreasing fall rates increase patient safety by reducing harm and ensuring that our patients are getting the quality care they deserve. And in conclusion, falls make up for about 40% of all hospital-acquired events. So falls are also a nurse-driven quality metric that we can impact ourselves. And having a falls team and incorporating the hourly rounding will assist with decreasing falls within our hospital and help accomplish the goal of giving safe, quality care to our patients at our facility. Y'all have any questions?
Okay, so you did say that most of the falls are from going to the restroom.
Yes. Most of them are related to, that we looked at so far, are related to getting up to go to the restroom, and on some floors it's night shift, some floors it's day shift. Any other questions? All right. Thank you for your time.